So let's start looking at some of the more important and significant titles in a little bit more detail. And let's start with Title I. Most of what you've heard about the ACA, chances are, is somewhere in Title I. So we're going to spend some significant amount of time helping you understand this vital title. Some people, by the way, also say that the Affordable Care Act was based on what was done in Massachusetts in 2006. That statement is both true and not true. It is true as it relates to Title I. Title I was absolutely based on the conceptual model of Massachusetts health reform, but Massachusetts health reform did none of the other things that are done in Titles 2 through 9. So understand then that connection, that Massachusetts informed this structure. The way to understand Title I, importantly, is there are two major portions. The first portion is a set of reforms to health insurance coverage for most Americans that took effect in 2010 and 2011. So, for example, the ability of young adults to stay on their parents' health insurance policy up till age 26 was one of those early reforms. That's actually resulted in about 3 million otherwise uninsured Americans being able to get coverage that way. And there's also, in Title I and the early part, the elimination of what are sometimes referred to as lifetime or annual limits on health insurance policies. So it's very common in health insurance to say, yes, I pay my premiums all the time, but if I get really, really sick, it's quite possible my insurance plan will have a limit on how much they will pay out for me in a given year or over my lifetime. And through the Affordable Care Act, annual and lifetime limits are now illegal in all 50 states in all health insurance. Okay? Also, there are limits in terms of how much an insurance company can spend of your premium dollar on expenses other than those related to medical costs. This is sometimes referred to as the medical loss ratio, or MLR. But so right now, if you buy health insurance and your health insurance company spends more than 80 or 85 cents of your premium dollar on profits, return to shareholders, executive salaries, advertising and marketing, or other kinds of things, if they spend more than that, they have to write a rebate check to you for the dollar value of how much they violated the limits. And billions of dollars in the past several years have been returned to both individuals and small employers from companies that didn't observe the medical loss ratio limits. A lot of other things as well that have come into play. And frankly, if all the ACA did were those early reforms in 2010 and 2011, we would say this was one of the most significant health reform laws ever. And instead, we look at that first part of Title I and understand that that is just the warm-up. That is just the hors d'oeuvre or the appetizer. Because the big part of Title I came later, and it came on January 1st of 2014. And there are four major parts of the reforms that came into play on January 1st of 2014. First one is deep systemic reform of health insurance in the United States. A lot of different pieces. I'm just going to mention the most important one. The way the insurance industry has functioned since the 1940s has been through the use of a practice known as medical underwriting. So you come to me, let's say I'm an insurance company. You come to me and you say, I'd like to buy insurance from you, please. And I say, absolutely fine, happy to write you a policy. Before I do, could you please fill out this questionnaire with about 95 questions that will tell me anything and everything about your personal medical history for your whole lifetime. And I will look at that very carefully. And if I see that you had cancer, maybe you had a heart episode, maybe you have asthma or diabetes, maybe you went to see a psychiatrist sometime, anything I see, maybe you've been a victim of domestic violence, anything that I see that I don't like, I'll say, sorry, can't write you a policy, or yeah, I'll write you a policy, but I'm going to charge you a premium 2 to 3 times as much as anybody else, Or I'll write you a policy and I'll cover everything you've got except for your diabetes. That kind of practice was normal operating procedure for health insurance in the United States. As of January 1st, medical underwriting imposing pre-existing condition exclusions is now illegal in all 50 states. And instead we have a new regulatory regime that is called guaranteed issue. There's the requirement for health insurers to issue you a policy if you meet the essential requirements, and those do not include your personal medical history. Fundamental change in how health insurance is operated, now in effect because of the ACA in all 50 states. Again, you may think fundamentally terrible or fundamentally good. Let's just all agree it's of fundamental importance, fundamental change. Secondly, there is something called an individual responsibility requirement, which is known as the individual mandate. And this says that all Americans, all citizens and legal residents who can afford to buy health insurance and don't have it, have to buy it, or else they will pay a penalty when they file their taxes. This is based on what was done in Massachusetts, and it's done because there's a problem with guaranteed issue. And the problem with guaranteed issue is that if you just say everybody can buy coverage whenever they want, there are some people, particularly younger and healthier people, who will say, great, I will wait until I think I need some kind of medical procedure or medical care before I buy coverage. And the impact of that then is to raise the cost of health insurance for everybody who is coming in and buying coverage. And so the individual mandate, individual responsibility is done to try to create a more robust risk pool so that everybody's a part of it. It's really not a mandate, because if you simply don't buy coverage and you pay the penalty, you're in compliance with the law. You're not breaking the law. But that's an important part of this ACA, and particularly it's central to Title I. That was one of the central issues before the US Supreme Court, and the US Supreme Court decided that the individual mandate was constitutional. The third piece, the third fundamental piece, are subsidies to make the purchase of health insurance affordable for people who otherwise couldn't afford to buy it. These are income-related subsidies. We'll talk some more about Medicaid. Medicaid is there for low income, but for people above the Medicaid threshold and up to about what's called 4 times the federal poverty level, or 400%, which is an income of about $90,000 for a family of 4. If your income is below that, then you can get subsidies to help you both cover the cost of your premiums and to keep your potential cost sharing in your policy down to an affordable level. Then the fourth major piece are the creation of health insurance exchanges or marketplaces to help individuals be able to buy coverage. We've had this in Massachusetts since 2007. In Massachusetts, it's called the Health Connector. It's basically a website that you can go to, and you can do apples-to-apples comparisons between different kinds of health insurance policies. Now, the way the ACA was written, states, if they want to, have the ability to set up their own exchange. And if you look at this map that we're showing, this shows you as of last spring where states were. So the very dark states are the states that are doing their own exchanges. The light states are states that said, no, we don't want to do this. We'll let the federal government, through the Department of Health and Human Services, manage this work themselves. So they are not part of the exchange process. And then those mid-range blues are states that are what we call a partnership. They're doing some function of an exchange and not all the functions of an exchange. And so these are the 4 essential components of Title I: the guaranteed issue insurance reforms, the individual responsibility requirement, the creation of subsidies to make both premiums and cost sharing affordable, and the creation of health insurance exchanges or marketplaces. Believe me, there is a lot more in Title I. These are the fundamental, most important parts of that part of the law.